What is dengue fever? Dengue fever is a severe, infectious, flu-like illness transmitted to humans through the bites of infected mosquitoes. 4 different dengue viruses are known to cause dengue fever. Dengue is found in tropical and subtropical areas. It is endemic in some countries in Latin America, the Caribbean, the Middle East, Africa, Australia, the South and Central Pacific, and Southeast Asia. What is dengue hemorrhagic fever? Dengue hemorrhagic fever is a more severe form of dengue infection. It occurs when a person gets infected by a different type of dengue virus after being infected by another one sometime before. Dengue hemorrhagic fever can be fatal if unrecognized and not properly treated in a timely manner. What is dengue shock syndrome? Dengue shock syndrome is the most severe manifestation of the dengue virus infection. It usually occurs in children, sometimes in adults, experiencing their second dengue infection. Dengue shock syndrome is sometimes fatal, especially in children and young adults. How is dengue fever transmitted? Mosquitoes that are infected spread the infection to other people they bite. Mosquitoes become infected when they bite a person who has dengue virus in his or her blood. Dengue fever is not contagious from person to person. You can become infected with dengue fever more than once. Secondary dengue infections are what causes the more severe forms of the disease. What are the symptoms of dengue fever and dengue hemorrhagic fever? Symptoms of dengue fever start within 4 to 7 days after being bitten by an infected mosquito and include high fever up to 105 degrees Fahrenheit or 41 degrees Celsius, severe headache, pain behind the eyes, severe joint, bone, and muscle pain, nausea and vomiting, rash. Symptoms of dengue hemorrhagic fever include all of the symptoms of dengue fever, plus bleeding from the nose and gums, bleeding under the skin, causing purplish bruises, a decrease in the number of blood cells that help your blood to clot. What are the symptoms of dengue shock syndrome? Symptoms of dengue shock syndrome include all of the symptoms of dengue fever and dengue hemorrhagic fever, plus fluid leaking outside of blood vessels, massive bleeding, very low blood pressure. How is dengue fever diagnosed? Your healthcare provider can diagnose dengue fever based on physical examination, your symptoms, and by blood tests that can show the presence of antibodies to the dengue virus in the blood. How is dengue hemorrhagic fever diagnosed? Your healthcare provider can diagnose dengue hemorrhagic fever based on a physical examination, the symptoms, and by performing laboratory tests, including coagulation studies, dengue serologic studies, liver function tests, and platelet count tests. How is dengue fever treated? There is no specific treatment for dengue fever, and most people recover within 2 weeks. To help with recovery, healthcare experts recommend getting plenty of rest, drinking lots of fluids, taking medicine to reduce fever, taking pain relievers with acetaminophen and avoiding those containing aspirin. How are dengue hemorrhagic fever and dengue shock syndrome treated? As with dengue fever, there is no specific medication for dengue hemorrhagic fever or dengue shock syndrome, but early and aggressive emergency treatment can be life-saving. Healthcare experts recommend emergency treatment with fluid and electrolyte replacement, blood pressure monitoring, transfusion to replace blood loss. Management of severe forms of dengue hemorrhagic fever frequently requires hospitalization. How can you help prevent dengue fever and dengue hemorrhagic fever? The best way to prevent dengue virus infection is to take special precautions to avoid being bitten by mosquitoes. When outdoors, use a mosquito repellent containing DEET, picaridin, or oil of lemon eucalyptus. When outdoors, dress in protective clothing, long-sleeved shirts, long pants, socks, and shoes. Keep windows and door screens repaired. Get rid of areas where mosquitoes breed, for example, any place where there is standing water. What are the complications of dengue fever and dengue hemorrhagic fever? Some people, especially adults, may be tired and or depressed for several weeks to months after being infected with the virus. The more severe types of dengue fever, dengue hemorrhagic fever, and dengue shock syndrome can result in vascular, blood vessel, and liver damage, and can be life-threatening. For more information or referral, please call the National Hispanic Family Health Helpline at 1-866-783-2645.